This is Bob Beckel.
This is Cal Thomas, a conservative who is pro-life,
A liberal who once worked for Jimmy Carter.
who favors smaller government,
Who believes in big government.
and in a town full of cheap shot artists, I've never heard Cal take a cheap shot.
But even when he's wrong, he's likable. And this is Common Ground.
And this is Common Ground.
Welcome again to Common Ground, a video version of Bob Beckel's and my bi-weekly USA Today column in which we try to figure out how to bridge Washington's partisan divide. Well, Bob, today it's the Healthcare Reform Summit at Blair House. I've wanted to call this the Blair House Project. It's like I'm reminded of the old Sinatra song. I've got high hopes. I did coming into this, but after seeing how both sides are playing this game, it just looks like a couple of hyenas lining up to attack each other.
Now that you're very too pessimistic about this guy. Look, the Republicans are screaming because Obama came out with a plan.
Finally.
Well, yeah, finally came out with his plan. But now, what's wrong with putting your plan on the table? It's like, here's my plan, and the Republicans can show up with their plan, and they can see if they can find some areas where they can find agreement. Look, already there's a lot of areas of agreement, but I don't understand what the argument the Republicans have. I know that they're worried that they're going to be showing up and all that in an election year, but let's face it, they don't want to give Obama a health care bill.
I think they would if he came their way some. You've got 35 mentions of the word tax in the Obama plan, which, by the way, isn't really a plan at all because the Congressional Budget Office, nonpartisan, established by Congress to take an objective look at these sorts of things, says it can't come up with a cost figure because there are no details in the Obama plan.
Well, there's details this way. I mean, he came up with a brand new idea, which was to put caps, regulate premiums on insurance companies, because out in the West Coast, for example, in California, a health insurance company out there raised the monthly fees by 40%.
Yeah.
So would you have a problem with regulating health insurance?
I got two words for you on that.
What?
Richard Nixon. Wage and price controls never work, Bob. We have a history of this, and this is what baffles me so much. We have a history of what happens when government overcompensates, and we have a history when government gets out of the way and allows private enterprise to work. But look, you and I have agreed that there are fundamental reforms that need to be made in the way health care is delivered and health insurance is delivered. But more government regulation is going to give us Medicare on steroids.
Okay. Regulation, tax, and 2 things I don't want to talk to you about because you can't talk to you about it. Let's try to role play this for a second.
Okay.
Let's assume that you and I are sitting down there. You're representing the Republicans. I'm representing the Democrats. Now, let's start off with what it is that we agree on. Okay. Well, first of all, let's start off. How many unemployed people are there in America?
Well, this is you mean people without health insurance?
Yeah.
Yeah. Well,
the
figure floats. It's 35 million, 45 million, 50 million, depending on who is giving the figures. But wait, that is not a constant figure, Bob. You and I both know that. People move in and out of employment. People move in and out of insurance, and there are an awful lot of young and healthy people who don't want the expense of buying the insurance. They're starting out with their careers. They're starting out with a new family. They don't want this cost at the moment, and they should have the right not to sign up if they don't want to.
We should have the right not to have to pay for when they're skiing accidents and they go to the hospital. It costs us hundreds of thousands of dollars.
I'm fine with that.
Look, but let me say, so we can agree, you do agree that there should be some way to get some of these people insured who want to be insured.
Oh,
right?
yeah, absolutely, of course. The question is the process, of course.
Okay, all right, let's just see what we agree on. We agree that you ought to not be denied health insurance for pre-existing conditions.
Exactly.
Okay. 2, we agree that if you lose your job, you can take your health insurance with you portable.
Not only lose your job, but if you change jobs in another state or even within the state, you ought to be able to keep the insurance policy that is best for you. Yes.
And you can't have your health insurance dropped if you get sick while you're having this health coverage.
Precisely. That's one of the things that bothers me about automobile insurance. There are some insurance companies that are happy to take your money and insure you, but you get into an accident for which you are insured against, and they drop you.
Okay, that happened to me, as a matter of fact. Yeah. So, all right, so we can agree on that. Now, let's think about the places where we disagree. Okay, we know we disagree on your taxes. There still has to be some
Well, not
revenues.
fully, though, Bob, because I'm all for, and you'll like this, and we say this in our column, I think that employer-provided insurance ought to be taxed as a benefit with the money put into a fund or directed to people who have difficulty paying for their insurance. I don't know. That's a benefit. I don't have a problem with that.
Could we mark this date down? This is the day that Cal Thomas actually said that he was willing to raise some taxes. I agree with that. I think it's a very good idea for one who has to pay for health insurance out of my own pocket.
Yep.
There's no reason they shouldn't be taxed on that. Okay, okay, that's a good idea. Let's agree on that. Now let's throw some things on the table that are concessions on the part. As a Democrat, this is what I'll concede to you. I'll concede tort reform. I think that it's time to put tort reform on the table. There are doctors are under a lot of pressure from these lawyers who go around and sue them, do class action suits and the rest of it. Look, the trial lawyers are a big source of money for my party. But at some point, you have to say enough is enough. They've got plenty of other people to sue. So we'll throw tort reform on the table. What do you got?
No, I agree. I think you're absolutely right. The problem is I don't think that your party is going to agree to it precisely because of the reason that you stated.
Let's not.
All right, but I already said I'm for taxing the employer-provided health insurance as a benefit, not because I'm for more taxes, but it has to be targeted on where the money's going to be going. It can't just go into some general fund and be spent by the government.
All right, now how about the idea of the insurance exchanges where you can go out there and you can buy insurance?
Yep.
And you have a list of insurance policies like the federal employees have.
Absolutely.
Now, what do you think about cooperatives?
I'm fine with it if they're properly structured. And you mentioned the way Congress gets its insurance. Republicans and conservatives have been for a similar system nationally for years. They just can't get it passed. The Congress has an ability to, and federal employees, not just the Congress, to change their insurance policies as their circumstances change. It's not one size fits all. I'm all for that. Okay. And I think the insurance cooperatives are a way to go if they're structured properly.
We'd like to, of course, my side would like the public option still. Of course, I would like single payer, but I'm way off on the left on that. So I think I could live with co-ops. Anything that's an alternative to having to go and face the insurance industry. Okay, look, I think that's not a bad calculus. I mean, if you put all that together and maybe even take it out to the states and you have referendum, see if people will approve it. But I think we could cut a deal on that.
I like the referendum idea.
All right, there you go. Look. Okay, well, thanks, Cal. And look, that's Common Ground for this week. And check out our column in the paper and on USA Today's opinion blog at usatoday.com. Thanks for tuning in, and come back again for the next installment of Common Ground.